Hey kid, you want a cut? Ah, the life of a medieval barber. You are expected to handle it all. Need a haircut? You've got people covered. A tooth pulled? No problem. How about a gangrenous limb that needs amputating? Well, roll up your sleeves, because that's on your to-do list too. Barber surgeons emerged as practical problem solvers. Before you came along, monks handled much of the medical care. But in 1163, the church prohibited clerics from spilling blood. With your steady hands and sharp blades, you take over the messy work of surgery, bloodletting, and wound treatment. Over time, your role expands, and by the late medieval period, barber surgeons like you are in high demand, both in towns and on battlefields. That red and white striped pole outside your shop? It's not just decoration. According to legend, the red symbolizes bloodletting, the white represents the bandages, and the pole itself? That's what your patients grip while you cut them open. The modern American version of the pole also has a blue stripe, but we won't be talking about that. Your toolkit is as versatile as it is terrifying. Scissors and razors for trimming hair and beards, bone saws and scalpels for, well, you get the idea. Forceps to yank teeth and arrowheads from unlucky patients. And of course, your trusty fleam for bloodletting. Oh, you do not know what a fleam is? It's a simple metal blade, kinda shaped like a house key. The fleam would be held above the patient's arm or other body part and gently hit with a mallet to produce a cut. Sterilization? Never heard of it. Unless you are cauterizing wounds, you might rinse your tools in wine if you're feeling fancy. Otherwise, it's a quick wipe on your apron and on to the next patient. Infection isn't just a risk. It's practically guaranteed, as the germ theory was not a thing back then. But hey, if they die, at least you've got a new case study to learn from. As a new barber surgeon, you might ask yourself, what is the point of bloodletting? Why am I doing this? Well, in your times, bloodletting was one of the most common procedures believed to cure most things. It is based on the ancient theory of the four humors: blood, phlegm, yellow bile, and black bile. The idea, first proposed by Greek physicians such as Hippocrates or Galen, is that sickness comes from an imbalance of the four humors. A person in balance is a healthy person. Therefore, by draining tainted blood, the patient's humors will begin to align again. A patient comes to you complaining of headaches or fever? The solution is simple: drain some blood. You might use leeches, or, if you're feeling more hands-on, a quick slice with your fleam. Some physicians even insist on bleeding patients according to the stars, believing the moon can influence health, giving rise to the zodiac man. The rules here were also fairly simple, with each part of a human body believed to be connected with one of the signs. Need to operate on a foot? Then avoid doing it while the moon is aligned with Pisces, as they are believed to be associated with the soles of the feet. Does bloodletting actually work? Not really, but it's been the go-to medical practice for centuries, and people want to do it, so might as well keep providing the service and earn a living in the meantime. When bloodletting, herbal potions, cleansings, and even prayer fails, and you are left faced against a serious injury or gangrene, it's time to break out the bone saw. Amputation is your last resort for life-threatening injuries or infections. The key is speed, both for the patient's survival and their ability to endure the excruciating pain. You hand the unfortunate patient a stiff drink, tell them to bite down on a leather strap, and get to work. First, you cut through the flesh. Generally, you would avoid cutting through the bone, and instead go for the joint if possible. A few swift moves of the saw, or a solid strike with the chisel, where the tissues and bone connect, is enough to pop a joint out of the socket. The pain would be enough for a grown man to pass out. In most cases, that is for the better. After a successful procedure, you quickly cauterize the wound and hope the patient hasn't bled out yet. Will they survive? Maybe. Infection is a real threat, but if they do pull through, they'll have a decent chance of recovery. You do a lot of these, especially during wars. The battlefield is a barber surgeon's real training ground. Your skills aren't limited to surgery. You're also the go-to for dental work. Rotten teeth? No problem. Extraction is the answer to almost everything. No fillings, no root canals. If a tooth is causing pain, it's coming out. And yes, you'll be doing it without any numbing agent. The idea of toothworms burrowing into teeth and causing cavities was also somewhat common. In case the tooth was not rotten yet, you would insert a red-hot needle into the cavity itself in order to kill the toothworm causing the pain. In reality, this procedure would just damage the nerve endings, numbing the pain. Beyond teeth, you're also responsible for setting broken bones, stitching up wounds, and occasionally dabbling in cosmetic work. Based on the theory of humors, it was sometimes recommended to cleanse the body. You might wonder, how would I help my patient cleanse their body? In practice, this often meant literally washing them. And yes, you'll be performing plenty of enemas over the course of your career. Besides these common procedures, sometimes even more drastic measures need to be taken. When a patient suffered head injuries in battle or behaved unusual, the idea was that there might be something wrong with their brain. So what do? The answer is obviously trepanation. You drill a hole in the patient's skull to relieve the pressure and then take a look inside to see if the brain looks healthy or not. After that, you don't do much else besides closing the wound as best as you can. Surprisingly, the procedure wasn't as deadly as you might think, as a solid half of the patients lived through the procedure until most of them were taken out by infections weeks after. As a barber surgeon, you might also find employment in a monastery. At the time, Catholic monks were required by the church to keep their heads shaven, which meant steady work for barbers such as yourself. In addition to keeping their bald, shiny heads in pristine shape, you might also be asked to help with making medicine as well as to perform your regular treatments on the monks. To the people around you, you're both a miracle worker and a butcher. Some see you as a lifesaver, others as a last resort. Your reputation can make or break your business, so you'd better get results. You don't have the same status as university-trained physicians who scoff at your lowly trade. But guess what? You're the one actually treating people while they debate ancient medical texts. As time goes on, barber surgeons like you help advance medical knowledge. You might study the works of Galen, or adapt techniques from the battlefield that eventually become standard practice. By the late medieval period, apprenticeships become common, ensuring that future barber surgeons learn the trade. Your methods aren't perfect, far from it. But you're laying the groundwork for modern medicine, one risky procedure at a time. Thank you for watching. If you enjoyed the video, consider liking and subscribing. If you want to see more videos like this, check out the on-screen playlist.